Hi, friends. Thank you for joining us again. This is Sunil Chandy, and this is Food for Thought, a ministry out of Christ Episcopal Church. And if you're here with us today, we hope that you will connect with us. Tell us that you're here. Tell us that you said hello. Say and connect with all the people who are watching with us today at this time, this half hour of show. And I think Donna Becker is on, and thank you, Donna, for joining us, and I hope that you enjoy your time watching us as well. Christy Allardyce is on. Yes, Christy, and I think you're traveling. You're in the midst of traveling, and hello, Christy. Thank you for watching again, and thanks for all that you do for our church. Of course, there are people who are watching on various platforms, and they'll chime in a little bit. And today, I don't have much in terms of food for thought today. I mean, I'm being a little pensive at this particular moment, and part of it is because this is almost the anniversary of our of this COVID virus, where in terms of not the COVID virus, but in terms of what the effect it had on our community here at Christ Episcopal Church, because this was around this weekend, or the anniversary of this weekend, we moved quickly from, in-person services to trying to connect with people through our online media platform. So it's kind of an interesting kind of year anniversary for us, and I know that we've learned a lot of lessons, and part of which is this the lesson about anxiety and how do we deal with the unknowns in the future. I know that for me, what has been most helpful is knowing that God is present in everything, in both the good in life and also in what is perceived to be by us the bad, because God changes. My fundamental belief, which has been reaffirmed this year, is that God changes even those instances of tragedy or perceived tragedy to be a blessing for us. And in this moment, I know with this online ministry, I've received many different blessings through this. I mean, the conversations that we've had with all these wise folks who are trying to deal with the challenges in their own communities and in our community, and the lessons that they have given us are powerful for me, and I pass that on through our community, through our connections, and so forth. People like Sharon Younkin, who is our guest today. She's going to be talking to us a little bit about the vaccines and the anxieties around the vaccines that are available to us. But also there are other connections that we've made with bishops from all over the country, and of course, and through this medium, we've been able to connect with people across not only Connecticut and Rhode Island, but across the nation, people in Florida, Arizona, Las Vegas. Well, Las Vegas is in Arizona, but I mean, all over the country, and then also all over the world. People in Australia, in Europe, in London, in India, in the Middle East. We've been connecting with many people, and that's been a moment of grace too, a moment where we've learned that I've learned that even in the midst of anxiety and of the unknown, that we're never alone. God is with us, and also our connections are very important. The people that we have helping us through this struggle, as they face their own challenges. The other blessing that I've come across is that I've actually, through these mediums and through this medium, was able to connect with my old high school friends and so forth. And in fact, one in the week before, I think the week before Holy Week, we're going to try and have, or I think one week where Ben and Jackie and I are working on having all my high school friends, some of my high school friends, connect on this medium. And so, even though this has been a year filled with anxiety, anxiety, fear of the future, fear of the unknown, fear of what's going to happen and how we're going to come through this challenge, it's also been a year of faith for me. It's been a year in which I have been, I've acknowledged and reinforced my faith in God to handle all of the situations before us. Of course, uh, my faith, it rests not on just God handling my problems, but God giving me the strength and giving us the strength to to deal with the real problems before us, to adapt and to be resilient. And that's been a wonderful reinforcement of my faith. And of course, there is the other part of that faith, which is my faith in the community I serve, and the community that continues to connect with me and our church. And so I'm just so grateful, even in this year filled with many different challenges, some of them very tragic. But I know that in the midst of it, there are blessings to be acknowledged. Um, so, but anyway, and to celebrate this year or to mark this time, we've asked, yes, Eric, happy anniversary. We're glad we made it this far. Father Eric, yes, and Neil, thank you. Good morning to you too. Today we have, to mark this anniversary time, we have Sharon Younkin. Sharon, who's been such a source of wisdom for our congregation, for this program, and personally for me. And so, Ben, please invite Sharon. Sharon.
Father Sunil.
Oh, so good to see you again,
Sharon. So good to see you. We're doing it, and anybody who's watching is doing it too. We've done it for a year.
Yes, amen, amen.
I can't believe you. Do you know the last client I met with in person was March 13th last year.
Wow.
This Friday will be a year.
A year, and Sharon, I got to tell you, I know that somehow you've just helped me make it through this year. I got to tell you that.
You've helped me too, Father Sunil. You really have.
Yeah.
Seriously, it's like teamwork, right? Definitely. Yeah. I mean, and also, it's kind of like sometimes when you have to rally yourself to help others, and share information, it kind of is a big incentive to keep yourself going as well. So I thank all of the viewers too, because you've been a big part of that for me. And, Sunil, feeling like we're a team definitely makes a big difference, right?
Yeah, no, that's the thing about my journey in life. It's just, I've always had the faith to find faith in God. God always brings people in my life that helps me to deal with my issues, my problems, my challenges, and makes the journey so joyful,
Yeah.
And I'm grateful to God for you, Sharon, that we've connected. I mean, of course, you were singing in the choir way before,
No.
But then we got to know each other more. Through this experience, and it's
really, it's so true, so profound. And I feel probably a lot of people have had that happen, where they've had the different core members of their support, or that they feel like they've really gotten through this whole past year with. And we really need to pause and congratulate all of ourselves for our resiliency and strength for making it to this point. And I know I've learned a lot. We've all had to practice flexibility. We've all had to practice feeling comfortable with feeling uncomfortable. We've all had to practice our faith. I mean, there are so many ways we've been challenged to grow and I think we have been growing. And sometimes it's really tiring, and sometimes it's really uplifting, and runs the whole gamut. But I know
And you know,
yeah,
one of the things I also acknowledge through this time is that nothing is perfect, and it doesn't have to be. You know,
no,
we could kind of, as long as we try something. I mean, it's interesting because I just have a note from Ben right here. He goes, and he just picked up on an error that I just made, which is Las Vegas is in Nevada, not Arizona. But that's okay. And part
yeah,
of it is just the acknowledgement that, you know, that even when we live life, it's not going to always come out perfect.
no,
But we still live. We still find joy. We still put ourselves out there, and that's what another thing that this year has taught me. I mean, you
mm,
know, the in-person services, that hasn't been perfect, but we've improved. Our online media, we initially it wasn't perfect, but we've improved. We kept
right,
trying. You know,
yes, yes. Expertise comes from practice,
yeah,
not
yeah.
from overthinking. So, and I think we had to at various times during this pandemic. I felt like I was building the airplane and flying it at the same time, and I'm sure you felt that way too in the
Oh,
beginning
yeah.
when we first had to make all these transitions, and it was really it was a lot. But I want to talk too about the vaccinations, because I think that's really important right now.
Yeah.
And I listened to your episode last week with Bishop Nisley, and I really enjoyed that. I thought I really love. First of all, can I just say I love the fact that you two are both men of science as well.
Yeah. Yeah.
And I think that's so powerful. It's such a gift that you give to our community, that you have that perspective. And I think that's really important right now. And so part of the research that I did for the topic today was I've been listening to a guy. I have a couple of folks who have been close to me who are epidemiologists, and one worked at the CDC, and she recommended Dr. Michael Osterholm. And I've listened to his podcast on and off since the beginning of the pandemic.
Mm-hmm.
And I love his style. He was the epidemiologist of Minnesota for many years. He has investigated infectious diseases for 45 years. He worked for the CDC for a while. I think he's on Biden's task force right now. And he has typically a very no-nonsense Midwestern kind of style, where he looks at the current data that we have, where we are with the pandemic, and he tries to balance it with being practical, living your life, and also, being safe. So I like his approach because he also recognizes people still have to work, and they still have to, have these other things as well. But let me just summarize. I listened to his most recent episode,
Yeah.
where he thinks we are with the whole pandemic right now. And then I thought maybe we could move into how Rhode Island's doing, and then maybe we could wrap up with what's the psychology behind vaccinations? Because one of the things I've learned about this pandemic, there is a ton of psychology in terms of people's behavior, at all levels. We've had so much of that. So Dr. Osterholm was talking a bit about this new variant that's out. There's a new variant of the virus that's out. And he's a little bit concerned. He sort of sees another surge, that we're kind of around the corner from another surge. Hopefully we will have, by the end of May, the administration is saying that there should be a vaccination for all Americans by the end of May. He was talking about how 80% of the deaths occur in people who are 65 and above. So that's our most vulnerable population by far. And that actually, we know from the research that a single dose, so even if you just get one of your vaccinations so far, you haven't gotten the second one yet, even a single dose can reduce your risk of serious illness. So, I think people are concerned, can I get the second dose, or how's that going to work? I think even just working to try to get that first dose right now would probably be very important. We have 45% of the population currently protected. If you look at the number of folks who've been vaccinated, and also the number of folks who've had COVID and have some antibodies. but that means we still have 55% who are still vulnerable in the country.
Wow.
And in order for us to reach herd immunity, we need about 80 to 90%, and we're at 45%.
Wow.
And what's meant by herd immunity is basically when we have 80 to 90% of the population who have either had the vaccination or had COVID, the virus just doesn't have enough hosts to spread as easily. And you're really kind of effectively shutting down the virus. So we're still like 40, percent of the population away from that.
Yeah.
Now, he was also talking about the Johnson & Johnson vaccine. And he's saying how there's been some hesitancy because the other two, Pfizer and Moderna, I think are 95% effective.
Yeah, 95%. That's the number that I've heard, 95 to 97%.
95 to 97.
Yeah.
And I guess Johnson & Johnson is 75%, around that number. And he was talking about sometimes folks are hesitant because they think, well, I don't want to get the lesser of the vaccinations, but he makes the point that it's 100% effective against death.
That's right.
Right.
Yeah.
So if you do get it, you're not going to, you're protected from the worst case scenario. So therefore, wouldn't we say therefore then that it's effective, right?
That's right. Yeah.
So that's kind of the logic there. So 23 million of our folks are still unvaccinated, who are greater than 65. So he's
23 million, so let me just
23 million of our 65 and above are still unvaccinated.
And these are the people that are most vulnerable to this virus.
Yes, the most vulnerable to having the worst case outcome. Yes.
Yeah. Yeah.
And therefore the ones we really need to protect the most. So then I got on, I don't know if you wanted to make any comments about that so far, and then I can talk about what's going on in Rhode Island, but.
Yeah, no, I think, in that conversation with Bishop Nisley, and I think it just, I think it's just, we have this opportunity. God works through science, right? God works through all of life and all of creation, and this vaccine is actually an act of love. People put it out there so that we could save lives, and so to not engage in that is foolish, I would think. It's the idea about even the 75% effectiveness of the Johnson & Johnson. I mean, if it prevents you from dying, yes, take it. Take it. Make sure that you live so that you could make the world a better place, and then survive to make a world a better place. I mean, and I also love the conversation. But even if you take the one dose, if you don't worry about how you're going to get the second dose, because they'll. My sense is I have faith that they'll get the second dose. But our economy is ramping up the drug industry, helping them to kind of helping them to help us as a community. And so when you have the opportunity to get the first dose, don't worry about whether you're going to get the second dose. Get the first dose. I love that conversation that you've encouraged, Sharon. Get it. And then worry about, then look to get the second dose. Don't worry about something if it's not even a possibility, Yeah,
let's not be a perfectionist about this right now. We have enough data, Dr. Osterholm is saying. And check out his podcast. It's called CIDRAP, CIDRAP. I always recommend that people do their own research. You can listen to his most recent podcast. It's called Winnable Moments. And you can hear for yourselves what he's saying. And I think, and also, of course, that's also with the stipulation of if you have any underlying conditions, that you're concerned about in terms of the vaccination, always make sure you talk to your provider, your doctor first. But, I don't know if folks realize, though, that typically, because of my friends who work in the field of, okay, so here we go. Every location gives you an appointment for your second dose when you get your first shot. So that's great.
Yeah.
that folks who I know who work in epidemiology were saying before this is a miracle, really. This is a miracle because I don't know if people realize typically it takes almost close to 5 years for the development of a vaccination, for it to roll out, to the fact that we've been able to do it this quickly is
It's amazing. It's a miraculous situation. I mean, when I was in pharmacy school, we used to talk about the drug approval process through the FDA process, and yet 5 years is that's actually very that's actually no, a very liberal way of looking at it. It usually takes about 10 to 11 years to get a drug from development onto the market where people can
wow.
take it. And so what we've done, what America has done, the world has done, has made this, and it's an amazing miracle in terms of collaboration. It has shortened it to about 9 months, less than 9 months to get these drugs out of there. This is amazing.
Mm-hmm. Yeah, it's really a medical miracle, really.
That's right. And, you know, and to the other point, Sharon, the idea about side effects, of course, you have to look and see if you're allergic to any products or components of the vaccine and so forth. But one of the things that I think that we also have to acknowledge is that all of the drugs that we're taking has some kind of side effect. There's like, if you look at the package insert of any drug, even Tylenol, right?
Yeah.
They'll list all of the side effects that are possible.
Right.
And it's not, and even if it's a 0.1% chance that you might have it, you get a side effect, and that's a real reality. But they list all these side effects because it's another way of helping indemnify the companies. They're saying, hey, look, you know, if you do get this thing, just know that this is a chance, but it doesn't mean that it'll be a side effect that you'll experience or I'll experience.
Right. Yes, my understanding, Sunil, you know more than I, is that that when they do test out new medication, it's required that any adverse event, whether or not it's even related to the medication, someone could just have something happen while they're taking the medication, but they have to report it. And that if you look at Tylenol, if you really read it carefully, probably most people would never take it if they read all of the.
Right.
That's kind of because they have to report everything, whether or not there's a causal relationship to the actual medication.
Right. I think the causal relationship that people should really be worried about or aware of is the one who, well, if you get the virus, what's going to happen to you? If you get the virus, are you going to be able to survive it? And are you also, if you get the virus, are you going to pass it on to someone that you love that might not be able to survive it? You know, that's the issue.
And then that's where I think information is so key, you know, too, that to be really careful, you know, about where you get information. Typically the WHO or the CDC or your medical provider are the best folks. If you have concerns, certainly ask your questions. And I think it's much better to face your fear and speak with your provider and ask your questions than to just kind of sit in this place of indecision.
Right. And worry.
And worry, right? Yes. Problem solve, take action, research, get information. And so this is where we are in Rhode Island right now. We have 25% of our population, 16 and older, have had one dose of the vaccine. We are opening new sites in Middletown and Woonsocket. We are preparing for the 60 to 64 age range over the next couple of weeks to start with them. Or people may not know, if you are 16 to 64, if you have any underlying health conditions, you can also get a note and you can be vaccinated. So if you go to the Rhode Island Department of Health, you can see if you qualify for one of those underlying health conditions. And also I saw on there on the website that you can register for home visits. If people are homebound, I think so now they can be vaccinated as well. So to make sure the Rhode Island Department of Health, that you check that out.
Yeah. That's wonderful. I mean, I got to tell you, you know, I spoke with you Sharon, just a little bit before the show that, this Sunday, Simi was at Foxwood. Simi, my wife, was at Foxwood, and she was vaccinating over 1,000 teachers from Connecticut, and they really have a wonderful system in place now that many people are being vaccinated, and I think Rhode Island is catching up. I mean, and she was telling me that, and she works through Hartford healthcare systems, that we had some Rhode Island teachers who teach in Connecticut were able to get the vaccine at that on Sunday. So it was just, and that's good. That's
Yeah.
good.
Very good. Excellent. Yeah. Such important work that she's doing, and it's so, I think right now it's so important. We're almost there, right? We're almost there, but I do think we have to keep pushing. I do think we have to keep pushing through, and let's finish this. Let's get it done, because there are some reasons. There's some, and I'll just talk briefly. There's sometimes reasons why people are hesitant to get the vaccinations. And so I did do, when I was looking at the American Psychological Association website, there was a study done by the Kaiser Family Foundation at the end of December that 71% of folks would be willing to be vaccinated. So that leaves, 29% who are not at this point, or who are hesitant. And some of the reasons, why are some of those reasons? Sometimes it can be a mistrust of the medical community. And so I think in those cases, I would encourage, speak to your provider, get information, or maybe speak to someone like Father Sunil, who you trust, who has also the medical piece. If you've had maybe some experiences where you feel you're not as trusting, or someone else, that you might know that has medical information, a pharmacist that you trust.
Yeah.
I go to the pharmacist for a lot of information when it comes to medication. And I don't know if people realize this, but if you call CVS, you can ask to speak to the pharmacist on the phone and ask them about medications that might, there might have side effects, or I always do that. If I have something that I'm taking over the counter that I maybe, want more information about, I'll just call up and make sure, that, so we have all that information. Some folks may be opposed based on their ideology. They feel as though it's limiting their freedom and their freedom of choice. And, I guess the article was talking about, in this case, to think about it, that maybe it's your right, rather than it being something being taken away from you. This is your right to live, to have this opportunity, this miraculous, hopeful kind of development that can bring us back, into more of a normal way of living, and give you many more years with loved ones. And then the last factor was motivation. Life gets in the way. People sometimes just, they may feel overwhelmed about the idea of scheduling 2 shots. And I would say, let's try to break it down and just go for the first one right now. And as Ben pointed out, they schedule the second one for you when you go for your first appointment. It may be that we may reach a point where you'll have to show proof of having your vaccination in order to fly or do other kinds of venues. So it may be just something to do to be more organized and kind of get it out of the way, so you don't have to think about it. Yeah.
I love the what you just, the subtext of what you were saying just now is just find out information. Find out information, and don't let the fear prevent you from acting in some way. Find out, call your pharmacist. I mean, we've got pharmacists have 6 years of education in terms of like pharmacy and medications and drugs. They know, and so any pharmacist at the local chain store is a good person to talk to. And of course, there's the primary care, your primary care physician. You've got nurses in our community who also know this information. And I think, we can find information if we search for it, and if we take, don't let our fears petrify us, but rather engage.
Mm-hmm.
I love that what you just reminded us of doing.
Mm-hmm. Yeah, problem solving for sure. Problem solving and getting information and so if you have concerns, ask questions. Get your questions answered.
You know,
Um,
it's also one more thing that I love the fact that you can actually get Rhode Island allows people to, if you're homebound, that they send people to you. That's interesting. I mean, I had a conversation with one of our parishioners yesterday. It was really, she was in the hospital, right? And she had COVID, and and I have to find out about this police chief, this not no this fire chief, but what happened was. She couldn't get home. She couldn't get home. And so and no one was there at home to pick her up because she was alone.
mm,
And so what she did was, she had a friend who called the local fire chief, one of our fire chiefs, and he had the COVID virus already. He had been vaccinated. He picked her up from the hospital and dropped her home. It's like those are the things that our community does when we watch out for each other. And when we get vaccinated, we're watching out for the people around us, not just our own survival, but for the people around us as we
mhm,
develop that herd immunity for our whole community.
mhm. Yeah, yeah, and definitely. And I check in every now and then with the choir members. They get together on Saturdays on Zoom, and I can see we're close. It's so hopeful. I'm hearing about people getting their vaccinations, and and I'm seeing that we're not that far away. We're not that far away. I think it's around the corner. I could see the summertime being a lot different, but I think right now we still have to buckle down. We still have some business to take care of.
Yeah,
Um, but it was still a good feeling. It's a good feeling. It's a good kind of pressure
yeah,
because I know, I'm feeling like no, this is pressure that's moving us in the right direction.
yeah. And also one more thing before we kind of end is that even as we get vaccinated, and even though people are getting, we still have to maintain those social distancing guidelines that we have until we're told that everything is clear. We still
Mm.
wear masks. We still wash our hands. We still, make sure that we're at the right social distance, and engage and help people that way. Again, it's an act of love.
Yeah.
It's an act of love.
Yeah, it is, and it's also an act of we're talking about self-love, right? Self-care. And and I'm seeing and when people get the vaccine, they feel this sense of relief, like they didn't realize how worried they were or how maybe nervous they were.
Yeah,
And also I see the sense of relief in their loved ones. Like I see the younger folks like, okay, my parents are good.
yeah,
Like your loved ones, it's pressure on them when they're nervous about your well-being too.
yeah.
You're protecting your loved ones by protecting yourself as well as protecting others. Yeah.
Sharon, thank you so much again for giving us wisdom, helping us to deal with the challenges before us in a thoughtful and wise way.
Yes, we did a lot of great problem solving today. This is an example of how we would do problem solving to focus on, a situation. So thank you for problem solving with me today, Father Sunil.
I'm grateful for you.
I'm
God bless
grateful for you too.
you. All right. God bless you. Again, just wonderful. It's always great talking with Sharon, and she gives me so much hope for the future. And it's not a hope in vain. It's true hope. It's hope that's already present out there that helps us to deal with the challenges of the day. So, as is our tradition, let us end our time with prayer. It's a prayer that was written and adapted by Bishop Thomas Brown of Maine. The Lord be with you. Let us pray. Jesus Christ, you traveled through towns and villages, curing every disease and illness. At your command, the sick were made well. Come to our aid now in the midst of the global spread of the coronavirus. Heal those who are sick with the virus. May they regain their strength and health through quality medical care. Heal us from our fear, which prevents nations from working together and neighbors from helping one another. Be present with those in authority who are making hard decisions. Support the medical professionals, emergency responders, and our caregivers. We ask this all in your name, Jesus. Amen. Join with me in the Lord's Prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not in temptation, but deliver us from evil. For thine is the kingdom, and the power, and the glory, forever and ever. Amen. Friends, go in peace to love and serve God. Spread the light of God to the people around you. If you are in that age group to be vaccinated, please go get vaccinated and spread the love and hope of Christ to the world around you. God bless you.
Thanks for watching. Did you know that you can join Christ Church from anywhere in the world? If you're feeling connected to what we're doing, email us today at communicate@christchurchwesterly.org.